Namaskar and welcome to Health Hour by Apollo 24/7. This is a show where we bring you Apollo's health experts to the live show and you can ask all your queries. And also on the show, we are going to give away certain discount vouchers and gift coupons. Keep an eye for them. We're going to share them towards the end of the show. Also, you can ask the queries in the live session directly. Our expert will answer your questions on YouTube. You must be watching this on multiple Facebook pages, but if you want your question to be answered, come on to the YouTube and then type your question there. That's where I will be able to look at the questions and take up the questions. Well, ये शो एक ऐसा शो है जहां आपके क्वेश्चन बहुत सारे लोगों को आंसर दे सकते हैं. तो आपके क्वेश्चंस टाइप करते जाइए because it's an answer for a lot of people. Also, we are going to talk about a very interesting subject this week. Everybody would want to have nice glowing skin, winter ho या summer ho, but winter में थोड़ा स्किन का इश्यू ज्यादा बढ़ जाता है. तो लेट्स टॉक अबाउट विंटर स्किन केयर टिप्स एंड वी आर गोइंग टू इनवाइट आवर एक्सपर्ट टुडे. डॉक्टर माधुरी is going to join us. Dr. S. Madhuri, who's a consultant dermatology and cosmetology at Apollo Hospital, Secunderabad. తెలంగాణ సే హే మ్యామ్ తెలుగు బాత్ కరెంగే. నేను కూడా తెలుగు మాట్లాడతాను కాబట్టి ఈ రోజు మన తెలుగు ఆడియన్స్ పండుగ చేసుకోవచ్చు. తెలంగాణ, ఆంధ్రప్రదేశ్ ఎక్కడున్నా సరే తెలుగు ఆడియన్స్ మీరు వచ్చేసేయండి. మనం తెలుగులో కూడా మేడంని కొన్ని క్వశ్చన్స్ అడిగి తెలుసుకుందాం. ఆల్సో విల్ బి డూయింగ్ ద షో predominantly in English and Hindi. All the other viewers will be able to understand. चलिए आज हमारे एक्सपर्ट से मिलते हैं. डॉक्टर माधुरी, she is experienced 9 years of experience with Apollo Hospitals, professional memberships are into Medical Council of India, Telangana Medical Council, Indian Association of Dermatology, Venereology and Literacy. She's awarded and her achievements are first prize for epidemiological in Dermazone South 2015, best publication at Cuticon Andhra Pradesh 2016, presented posters in Dermacon 2016 and Dermazone in 2015. She is given her research and study papers in clinico-epidemiological study of pediatric hair disorders, pattern of pediatric dermatosis in tertiary care, I am doing this wrong, epidemiological study of geriatric dermatosis. Well, that's Madhuri Garu there. Good morning, ma'am. Welcome to the show.
Yeah, good morning, Jansi Garu. How are you?
Yes. Great respect. All well, ma'am. Thank you. Great respect to all your doctors and the fraternity, medical fraternity, who are always there, literally 24/7. ये जब से Apollo 24/7 आया है, you were also available on virtual platforms. So I understand that it gets
Yes.
hectic on you. But thank you so much for your time on Sunday morning.
Yeah, thank you very much.
Yes. So, Dr. గారు మీరు మెరిసిపోతున్నారండి. You're shining. అందరికీ we all want good skin, especially winter ho ya summer ho, we all want good skin. Let's understand the skin types. What makes us feel dry, stretchy or itchy? What is dry skin first?
Yeah. So, many people pose this question, especially in winters. People who come to OPD, like, skin is becoming very dry, very itchy. What is it? So, a skin which is healthy means the skin barrier is intact. So, what is skin barrier? It is formed by the outer layer of the skin. It protects us from pollutants, UV rays. It prevents evaporation of water and these things. So when that is damaged, so what happens is we lose water and oil from the skin, which makes our skin look dry and lusterless. So we call this in medical terms as xerosis, and generally we call it as a dry skin. So basically,
Okay.
skin barrier is damaged, that leads to dry skin.
So, does this affect only certain kind of population, or this is present across everybody and seasonally our skin changes and responds to the climate?
Yes, it is seen in everybody in every ethnic groups, but it is more in people who stay in the humidity, weather. These also have an effect on dryness of the skin, and people with some of the skin conditions and eczemas, they feel slightly more dryness than others, and children and elderly feel more dry than normal people. It's like this. It varies from one person to other, but it's generally a common problem.
Okay, so winters and skin. If I can describe the winter skin, కదా ఆకాశం సారీ భూమి నెరళ్ళు బారినట్టు పగుళ్ళు వచ్చినట్టు ఒక part అని కాదు, there are certain parts of the body especially which are prone to winter dryness, and ऐसे फट जाते हैं, होंठ हो या गाल हो. We are better off in South India. Imagine the North India and the weather. So we experience chafing and also other areas where it becomes really dry, flaky and itchy. What do we do to take care of our skin in winters?
Winters, yes. This is a very important question to everybody, what you asked. So, the major thing which protects us, or which, which decreases dryness, is moisturizers. So, many people have so many doubts regarding what moisturizer to use, what to use on the face, what to use on hands, what to use on body. Like, like I have just normal skin, but I want to take care of our skin in winter. Some people will have very dry skin, what they should apply. This is something people are very much concerned. So here I
जी.
want to tell you about, I want to make you confident, like what to choose and all. So
That will be
you
lovely,
need
ma'am.
to.
You have that will be absolutely delight. I'll be delighted to know. I have this doubt कि moisturizer मैं use करती हूँ तो should I be using the same moisturizer for face and hands? Is
Mm.
that enough? And what I find so much of variety in the market. कोई लिक्विड होता है, कोई जेल होता है, कोई लोशन होता है, कोई अदर बेसेस होते हैं, कोई बहुत चिपचिपा होता है. What are these different kinds of moisturizers and how do we choose these?
Yes, like I'm going to tell you something. So, at the later part of this, you'll understand what to choose where. So, certain terms you should know. Key, what is an emollient? Emollient is synonymously used with moisturizer. So, what is an emollient? Emollient, it prevents evaporation of water and oil from the skin. So, basically, the emollients can contain water and oil. So depending on the amount of oil and water, they may be greasy, they may be light, like that. So this is emollient. And there is something called humectant. What is humectant? See, what I told you about emollient, they prevent evaporation of water and oil from the skin. What does a humectant do? It absorbs water from the atmosphere and gives to the skin. So both
Okay.
are different. So the common examples of humectants are this hyaluronic acid, which you see is a humectant, not an emollient, and the glycerine is a humectant. It absorbs from the atmosphere and gives us. And urea is an humectant. So this is the basic difference between emollient and humectant. So again, yeah, you're very much confused about what to choose, and cream, lotion, and ointment. You have moisturizers in all these bases and forms. What to choose? So, coming first to ointment. Ointment, as I told you, emollient or moisturizer will contain oil and water in different proportions. So, in ointment, it's mostly oil, very less water. So, it is very thick. So, no need to reapply, like 3 to 4 times a day, because it is very thick. So, and at the same time, because of its thickness, it's a bit greasy and it can stain your clothes. But it gives the best moisturizing effect. So
एक
people,
question here. Sorry to interrupt you, but
yeah,
when
yeah,
there
yeah.
are these thick, oily, greasy ointment kind of base में जो भी है, I have a feeling that the dust from the environment आके चिपक जाता है, and is that going to harm my skin more? That's always I'm always this worried about
Mhm.
external
Yeah.
pollution.
That is why ointments are used in people with very, very dry skin, because other things will
Oh,
not give any moisturizing effect to them. So these will be most effective to them. And apart from that, because they one more good thing about ointments is because they're very thick and water content is less. So there is no need of using preservatives. So they're very much suitable in sensitive individuals because there is no
okay,
preservative. Again, because
okay.
of its thick and greasy nature, daytime use it is not recommended because it's very greasy. So nighttime you can nicely use an ointment if you have very, very dry skin.
That's a great suggestion.
Yeah, morning times avoid ointments. And second thing is hair bearing areas, it is difficult to apply because it is very greasy. So hair bearing areas we should again avoid this. At the nights it is fine. But sensitive people and very, very dry skin, for them these are best. So
Okay.
coming to creams, creams have a balance of both. It's not like oil is more like ointment. So both balance. So it's not as greasy as ointment, but gives you
जी.
a good amount of moisturizing. So it has good spreadability. It can be used in hair bearing areas. It can be used daytime. So that
Okay.
is about cream. Lotions, yeah. Many of you use lotions only. So lotions, the water content is very much more. So it is very light to apply, very easy spreadability. Hair bearing areas very easy, but you need to reapply 4 to 5 times a day because its moisturizing effect is less, and
Less.
because water content is more, so there is need to add preservatives.
Yeah.
So whenever,
Please continue, ma'am. Please continue.
yeah,
My
you
camera
need to
fell down.
add
Yeah.
preservatives because the water content is more. So when you add preservatives, so whenever you're changing a new lotion, check it in a small patch of skin so that if it is not giving any reactions to you, then only apply it to the whole body. Otherwise, change the lotion. So lotions you need to check before starting the treatment. This is one thing. And yeah, this is a basic idea of what to apply, which kind of skin you should choose, what to choose and all. But yeah, coming to how to use moisturizers, this is again a very important question to people who are concerned about dry skin. So one thing is you should when you're using lotions, try to apply moisturizers as many times as possible, like 3 to 4 times, and immediately after you become wet, reapply. Suppose your hands are the affected area, so whenever you do a hand wash, apply the lotion in winters. So apart from this, one more important thing is apply immediately after bath. That means within 3 minutes. That when a little bit of wetness is still left in the body, when we apply in the damp surface, the moisturizing effect is more. So apply immediately after bath. This is one thing I wanted to add.
All right. Sorry for the interruption. My camera fell down and I had to readjust it. Issues of the virtual programming. So I hope audience bears with it. Thank you so much, Dr. Madhuri. Quickly, I'll do this in Telugu for the audience. మూడు రకాలుగా మనకి ఆయిల్ బేస్డ్ ఆయింట్మెంట్ బేస్డ్ లోషన్స్ క్రీమ్స్ వస్తాయి. రెండోది క్రీమ్ బేస్డ్ వస్తుంది, మూడోది ఆయిల్ బేస్డ్ వస్తుంది, సారీ వాటర్ బేస్డ్ వస్తుంది. ఫస్ట్ది
Lotions.
లోషన్ బేస్డ్. మొదటిది ఆయింట్మెంట్ బేస్ వచ్చినప్పుడు మీరు ఏం చేయాల్సి ఉంటుందంటే అది కేవలం రాత్రిపూట వాడాలి, ఎక్స్ట్రీమ్లీ డ్రైగా ఉన్న వాళ్ళు మాత్రమే వాడుకోవాలి. రెండోది క్రీమ్ బేస్డ్గా ఉన్న వాళ్ళు ఎవరైతే అది హెయిర్ మీద లేకపోతే కొంచెం హెయిర్ ఉన్న బాడీ పార్ట్స్ మీద కూడా రాయొచ్చు, అది ఈజీగా స్ప్రెడ్ అవుతుంది. అండ్ లాస్ట్కి లోషన్ ఏదైతే ఉందో అది గనక ఒకసారి వాడితే సరిపోదు, మల్టిపుల్ టైమ్స్ మీరు వాడాల్సి ఉంటుంది. 4-5 సార్లు అప్లై చేయాలి, దాని యొక్క స్ట్రెంగ్త్ సరిగ్గా సరిపోదు. ఆల్సో ఇంకొక మంచి చిట్కా ఏం చెప్పారంటే స్నానం చేసిన వెంటనే తడిగా కొంచెం పూర్తిగా తడారిపోకుండా ఉన్న శరీరం మీద రాస్తే కూడా దాని ఎఫెక్ట్ ఎక్కువ ఉంటుంది. నేను సరిగ్గానే చెప్పాను మ్యామ్, ఏమన్నా పాయింట్స్ మిస్
Yeah, yeah,
చేశాను?
everything is perfect.
All right, ma'am. Thank you. So my next question would be, what are the skin conditions which might aggravate in winter? For example, my one of my niece has eczema, and I see that each winter she suffers quite a bit. Are there any other skin conditions which also get aggravated in winter?
Yes, yes, yes. There is psoriasis, which becomes much more in winters. And yes, as
Gee.
you mentioned, different types of eczemas in children and in adults, like, atopic dermatitis or seborrheic dermatitis, a lot of eczemas. Every eczema will increase in winter. And another problem is dandruff, again, that also increases in winter. And there is something called cold sensitivity. We call it cold urticaria. That is a kind of rash. You get all the hives when you're exposed to
Oh,
cold. Thing also
oh,
increases winters.
okay, so these are the conditions which might get inflamed or get even worse in winters. What do they do? For example, we'll start with eczema. What are the kinds of
Hmm.
eczema and what do they do in winters?
Yes, see, eczema is something, in simple language, to put it in simple language, it is itchy, dry, rough, and thickened skin. So
Gee.
these are the four characteristics of eczemas. So dryness is the major component of it. So obviously it is more in winter. So eczemas increase in winter. So what are the different types of eczemas? So See, eczemas can be endogenous or exogenous. Exogenous means from outside, endogenous means from inside. So, from outside, what are the different things? You may be allergic to something, you may be irritant to something, those can cause eczemas. So again, what is endogenous eczemas? All these atopic dermatitis in children, or there is purely one eczema which is because of only dryness. We call it the steatotic eczema. That is also one type of eczema, and there is this stasis eczema which comes in people with varicose veins. That we
Acha.
call, the veins on the legs become prominent and swollen. That also leads to
Hmm.
eczema. And there is this dandruff like eczema in the scalp that is called seborrheic dermatitis. That is also one type of eczema. So one thing I want to make sure about, make you aware in eczema is there is no complete cure for this. Only thing
Correct.
is we control it. See, if a person gets diabetes or anything, will it go away from the body? No, we'll only control it. In the same way, eczemas and psoriasis are such that we keep them in control. They are never cured.
Okay.
So,
So then psoriasis में क्या होता है? Winter and psoriasis में what happens when is it
yeah,
sensitive?
yes, so much. See, what happens in psoriasis in a simple language? See, normally our skin is layered, right? So, normally what happens, the cells form in the lower layer, they travel to the upper layer, they become dead and shed off. This takes 1 month time in general people, and it happens in one day in psoriatic people. So, what happens? The skin shedding, which is not evident in other people, that is evidently seen in psoriatic people as those patches. So, because of dryness, this again aggravates. This process is more faster, so psoriasis is more evident.
Yeah. So there must be different ways to tackle eczema or psoriasis. जो भी
Hmm.
वो लोग कर रहे हैं अभी, जो भी उनको राहत नॉर्मल सीजन्स में देते हैं, जो भी वो लोग कर रहे हैं, I think that's what they should continue, or is there something else that they need to do in the winter?
Yeah, they should moisturize more obviously, and they should use moisturizers containing urea, lactic acid, which are humectants, as I told you, which absorb water from the atmosphere. They need to use more of those, not emollients. That is one thing. And take shorter baths. Don't take longer baths, and very hot water don't use. Use only lukewarm water.
Yes.
Take shorter baths, and this will help you, reducing the dryness. This is for general people also, but खास करके psoriasis में ऐसा करना है.
Oh, all right. Thank you, ma'am. So, while I start taking questions from the YouTube, I just was glancing at the other questions as well. Let me take up this. Naitik Joshi ji का question है, how to reduce lip tear in kids? Maybe chapped lips के बारे में, chapped lips के बारे में बात कर रहे हैं ये. So,
Yes,
children. Let's also talk about children and winter
yes.
skincare.
So, yes, what I want to tell is lip is very sensitive. See, the whole face is a sensitive area, but there are two areas which are extra sensitive. One is eyes, and other things is lips. So, as we are feeling dryness of skin in, or general skin in winters, lips also get dried. So, one thing what you should do is, there are special lip balms available which help in treating the dry skin, the skin which has got many cuts. General lip balms are to maintain, but with some other emollients, humectants, what we give, they help in maintaining that moisture more. And you need to reapply the lip balms like 4 to 5 times a day. And second thing is hydration. Ask him to take a lot of water, like multiple times water. Hydration is important. And vitamin
One
C
question
also.
here. While you're
Yeah,
talking about water, my question would
yeah.
be, will my, while skin is being dehydrated due to extreme external sources, is it also caused by internally if I'm not being hydrated enough? Will that show up on my skin?
Obviously, healthy skin is hydrated skin. Hydrated skin means skin will take care of some of the things, and it should have some water from the body also, obviously.
तो
So
लिप क्रैक
hydration
भी
is very important.
डिहाइड्रेशन की वजह से हो सकता है.
Yes, yes, हो सकता है. इसलिए drink lots of water, and children have this habit of lip licking. They do like this. That they should
Correct.
stop. Mm. Because the
What happens
saliva
with
will
that?
again irritate. Yeah, saliva
Ah,
has certain irritants. It irritates, so the skin reacts, it becomes dry and very rough like that. So that licking should be stopped. Lip balm usage 3 to 4 times a day, drink lots of water, and vitamin C tablets may help you a bit more
great.
than these things. And I want to add
Super.
another point in adults. Adults, if they get these now, avoid lip cosmetics.
Here's my Suchita Bharadwaj ji का question मुझे यहाँ पर दिखा है, who's asking about pigmentation of lips and how to remove. Winter में dark हो
Yeah.
जाते हैं and then we tend to put cosmetics on it, add color to the lip balm. Do you suggest these colored tinted lip
Hmm.
balms, ma'am?
Colored aisle, if you don't have any problem of per se you any dryness or any cracks on lips, any itching, any irritation, then you can use anything, like lip balms, lipsticks, you can use anything unless you don't have any problem. But if you have any
जी.
problem, excessive dryness, some people have, they can't even open the mouth because this area on the corners of the lips are especially
Yes,
dry.
these areas. Yes.
So those people should possibly avoid lip cosmetics. And color of the lip, yes, I'll tell you why it becomes more dark in winter. So as I told you about skin barrier, so when the skin barrier is damaged, what happens? Skin becomes more susceptible to sun. So sunlight will damage you, or will tan you more than what happens in summer. So your lips tend to get tanned in winter. So tanning can happen because of sunlight, because of cosmetics you use. These are general factors. So lip
Yeah.
lightening, yeah, tell me.
Yeah. Anyway, you started with the sun and winter sun damage. Mr. Shamir AK's question I want to take up. My face is full of tan in winters. This is also, I think you should add about winter sun damage and sunscreens as well while you continue
Sunscreens,
with the question.
yeah, a very common. The question people pose me in OPD is about sunscreens. Yeah, you should know certain things about sunscreens. So you people just you hear a lot about you hear a
Yeah.
lot about this SPF booster rating. What is this SPF 15, 30, 50? So what to choose? You people are confused totally. So what to choose? See, first you should understand about the I'll tell you briefly about the sun damage, what it causes. So there are three types of sun rays: UVA, UVB, UVC. So UVC is completely absorbed by the ozone, it doesn't reach us. UVB, most of it is absorbed, but some of it will again reach to us in the you know uh, in our day. Most of the light is UVA. So again,
A.
UVA, UVB. UVB is more dangerous. So in short term, it causes sunburn, long term cancer. UVB.
Yeah.
UVA, yeah, 90% of our sun rays is UVA. What it causes? It causes tanning, photoaging, all these photosensitive disorders. All these are because of UVA. UVB is more severe. UVA causes this
Yeah.
kind of tanning and all. So we need protection
Especially
from both.
geographically, areas like Australia, certain continents do report a lot of skin cancers due to
Yes,
thinning of the ozone layer.
because of ozone filtration is one thing, and I'll tell you. See, UV rays again differ from in the day itself. They differ. So during the noons and between 11 to 3, UVB radiation is more. So like
Oh,
more damage. So UVA is also
that's the
more, but
reason
UVB.
why your medical fraternity always advises early sun le lo, morning sun le lo.
Yes, and sunscreen, it is very important. So, what is SPF? Many people ask me if I'm using SPF 50, I'm using SPF 60. SPF is sun protection factor, it measures only UVB. That means
Okay.
the more severe damaged rays, that measures only UVB. And coming to SPF 15, it blocks 93% of UVB, and SPF 30 blocks 97%. SPF 50
Okay.
blocks 98. So see, if you move from SPF 30 or 50, there is only a bit of 1 to 2% blockage difference. For that, what happens? The sunscreen becomes more greasy, more oily if you go to SPF 50. And if you don't have any particular pigmentation problems or sun sensitivity disorders, you can settle with SPF 30. That is perfect. It is good for your, good enough for the protection, and it is not, very oily, very greasy. So general people, SPF 30 is generally enough. So
Super.
Booster rating, that is again very fancy and given in every sunscreen. So booster rating, it measures UVA. So
Okay.
UVA is like tanning and these things. And second thing is, what is an ideal sunscreen? Ideal sunscreen
Yeah.
should, I'll tell you one more thing. If, sunscreen can be physical and chemical. So physical
Mm-hmm.
sunscreens are very good. They can be used in children also. But the thing is, they're opaque and they give this white kind of feeling. So
Correct. They give you a green kind of appearance.
yeah, yeah, yeah. But in
We
between
see
the
a lot of
line, like
cricketers while playing, they have this white
yes,
sheet on
yes,
their
those are all
cheeks
physical
and
sunscreens. So a
yeah.
decade back, people stopped using these physical sunscreen, completely shifted to chemical. But now, micronized forms of physical sunscreens have come, so that much whitening effect, opaqueness is not seen these days. So you can nicely go to physical also. So your ideal sunscreen should be a combination of physical and chemical. It should be broad spectrum, means UVA and UVB, both protection, and it should be cosmetically elegant. Again, you cannot show off everything like I have applied
Correct.
sunscreen to the world, right? So it should be cosmetically elegant and uh,
So these are the
obviously ready
factors
to
which we
use.
need to look at while we buy our sunscreens. You
Yeah,
just cannot buy it by the number which you see as an SPF. These are
yes.
other factors that you read, get aware of what you're buying and what you're putting on your skin and where you are. What kind of environment, how much of exposure, what kind of skin you
So if you're
have.
in hill stations prefer SPF 50 because the sun, is because of high altitude, it's a bit nearer to you. So the damage is more. So go to higher SPF if you stay in hill stations. 50 is needed. If you're not in a hill station, if you don't have any other issue, SPF 30 with a good booster rating is enough. And
Right,
how to
right.
apply? Again, this is something
Yeah, very, very important. When to apply, how to apply.
so to be very simple for the so that you can understand, there is something called teaspoon rule. So 3 ml, that means slightly more than a half a teaspoon. So that is enough for
Okay.
whole face and neck and for the arms. So
Oh,
3
it's
ml.
not just for the face and for the arms as well. 3 ml
No,
for
3 ml,
face.
yeah, 3 ml for the face and neck and 3 ml for the arms. That is 3
Okay.
ml. And in the teaspoon rule, second point is 6 ml. That means slightly more than 1 teaspoon. That is required for whole of chest, whole of back, and whole of legs. Remember, apply sunscreen on every exposed area. And second thing, yes, what I told you before, hair bearing areas, ointments and creams are a bit difficult to apply. So hands you prefer lotion, face you prefer creams or gels for
Okay.
that matter.
So all the sunscreens are also coming in these different bases. Choose what you will require and where you're applying it. What time,
Yes.
ma'am, and how frequently do we need to
Yes.
apply the
How
sunscreen?
frequently? See, any sunscreen is going to last for 2 to 4 hours. So if you're going out at 9 o'clock, apply 20 minutes before going out so that you get its effect completely. So if you're stepping out at 9 o'clock, you apply at 9, it won't start acting immediately. So apply at 8:40 and then leave at 9 o'clock. Again at 3 o'clock also you're staying in the sun.
Sun.
Reapply it. Not necessarily no need to wash your face, just reapply. That's all. Like 3 to 4 hours,
Great.
you reapply it.
Great, ma'am. So here's another question from Yashpal Singh ji. He's a diabetic suffering from skin rashes in my legs under knees. So let's also talk about elderly and their skincare, and especially if they're diabetic.
Yes. So elderly is again different requirements for their skin because they have this change in the lipid component. I told you now the moisturizing skin barrier, it has both oil and water. So this oil component, lipid component changes as we age. So they become less. So obviously, not only in winter, in summers also they become very, dry for
Yeah.
them, and the dryness leads to
No
itching
luster.
in elderly. Yes.
Yeah.
So for them especially, yeah, and some of the medications they use is diuretics or any other medications also can dry them out more. So what they should do is, as I told you, they should use moisturizer very frequently and prefer ointment base, and take shorter baths, and try to reapply it more and more often. That is something
Yes.
required for them.
May I quickly add something else here, that our elderly are not used to these cosmetics, whatever that we think that we are applying. Younger generation and then बच्चों के लिए कुछ भी आप बोलो हम लोग यूज कर लेते हैं, बट देन अपने जो एल्डरली है उनके लिए कुछ क्रीम या लोशन या ऑइंटमेंट लाके आप घर में दो, ये they are not the generation who will like to apply and reapply. And these are the generation who would love to use oils on their bodies. For example, my mother would love to apply oil massage and then take a shower. What would you approve that?
Yes, yes. Many people do that, but again, plain oil, what it happens is, again, that is not completely plain. It contains some other kind of ingredients. It may contain almonds, it may contain something like that. Again, this extra added thing may irritate sometimes. That is one thing
Right.
which, and some people have the cultural practice of, they put neem in the oil, they heat it, and they apply. So what happens, these neem and all also they can again irritate. So the oil part, if it is non-irritant, it is okay, you can apply. But if it is a, most of the times they irritate the skin and they tend to scratch more. That will give them moisture. But what happens is they become more itchy because of the irritant nature, and they tend to scratch more and more if they apply oil. So that is why it's preferred to apply this emollient kind of things, or ointment kind of things only.
All right. So यशपाल जी का क्वेश्चन है उनका, डायबिटीज एंड देन स्किन रैशेस अंडर द नीज.
Yeah, skin rashes under the knees are 90% of time eczemas, and diabetes has, lot more chance of becoming prone to eczemas than normal people. So
अच्छा.
what you should do is, yeah, yeah, yeah. Not only in winter, take care of your legs and everything in summers also. Apply moisture and stop scratching. What happens in diabetics is they feel a bit of itching than other people because of there are some end products which are released in skin in diabetic people, so they tend to get itching, so they tend to scratch. So what happens when you scratch, our body reacts, and it that area becomes thick or rough, and that roughened skin or thickened skin, it'll itch more, so people tend to scratch more. Again, it will, the same cycle will repeat, and it will only aggravate your eczema. So what I want to tell is, don't scratch. If you're getting a lot of itching, there are some anti-allergic medication which you can take help in the starting, like around a month or so, with the tablet subside the itching and voluntarily stop some kind of scratching and use emollients. And if still the problem is not cured, there are certain ointments and all we prescribe for the rashes to reduce, we can go to them.
Yes, ma'am. And while you were talking about and then diabetes and eczema, as you said, they're related and they are together. एक बार वहां पर फिर से स्क्रैच कर दिए, हीलिंग नहीं होता है उनका, फिर वो बढ़ जाता है.
Is a bigger problem if you leave a wound there. So if you are uncontrolled diabetic, that wound won't heal. That is another problem. So that is why we
जी.
need to be very careful in diabetics. Don't go on scratching at all. That will lead to more problems. Take the help
And
of
any
tablet
other
to reduce
personal.
itching.
Yes, and personal consultation के लिए Dr. Madhuri will be available on 24/7. This is not the platform where she can take up individual cases, and it will be personalized for you. Go ahead and get a proper consultation with her so that she can advise you medication as well. Ma'am, here's next question, which is a very very important genre that we're going to open up. Shikha Jain ji पूछते हैं, and also Ashish Prem ji, both of them are asking similar questions. Ashish Prem ji पूछते हैं, how to reduce dandruff in winter, ma'am. And Shikha
Hmm.
Jain is asking, ma'am, in winters I suffer from excessive hair fall, excessive dryness in my body and scalp. And I experience this too.
Dandruff is something which aggravates in winters again. So, what is dandruff? So, dandruff are dead cells which has lost contact with the scalp, but they are adherent to each other. So, they form this sticky flakes kind of thing. That is basically dandruff. And there is a bit of fungal component. There is fungus called malassezia which grows in this scalp area. So, they are dead cells and they contain a bit of fungal component. So both of them are
Yeah.
there in dandruff. So, how to treat them? So, as I told you, the basic etiology or basic thing what is there in dandruff. So, how to treat them is, we need to give something like which will lyse the dead cells. So that we call as keratolytic. So that salicylic acid based shampoos are available, and again there is something called zinc pyritrone, which reduces the sebum production. Sebum is something which is which leads to dandruff and this kind of acne and all. When the sebum production is more in our skin, we tend to get more dandruff and more pimples. So these kind of salicylic acid and zinc pyrithrone shampoos, they help you reduce those dead cells. And there is tar also which helps, but again tar is messy and that black color and oily, so we don't prefer in general dandruff. Another thing, as I told you, there is a fungal component, so we need to add in some antifungal to the dandruff preparation. So it can be selenium sulfide or ketoconazole. These are the things we use to treat dandruff. So how to use these is, make your head bath like every alternative. What happens in winter is people leave this head bath, they do once a week like that. That leads to
करेक्ट,
more
ठंड की
sebum
वजह से ना
production.
कम कर देते हैं वॉशिंग हेयर।
That
अगर
leads to
पहले
more
दो
dandruff.
तीन दिन में करते थे, ये तो हफ्ते भर में नहीं करते। हम्म।
That is the biggest mistake people with dandruff do. Don't do like that. Do every alternate day, even in winters. That that sebum which is produced is washed away, so less chance of dandruff. And then don't apply oils also to the scalp. If you want to apply to the niche ki hair, but leave the scalp, because again scalp oil can lead to growth of fungus more. So dandruff is more.
ग्रेट। तो आशीष प्रेम जी, आपने सुना होगा कि द शैम्पूज और एनी अदर टैबलेट्स आपने जो पूछा है, मैम ने सर्टेन नेम्स दिए हैं। वी डोंट डिस्कस ब्रांड नेम्स हियर, बट शी इज गिवन यू what kind of shampoos you can look out for and how do you use them. That's a great thing. And Ravi Naik Mudawat ji पूछते हैं, this is the next question, ma'am. Every year in winter, my skin and the hands are peeling out and I lose my thumb impressions as well. It's a very big problem for me to log in biometrically in the office. Please suggest.
Oh, this is one more very common problem. People come to us. See, many students also come. Like my biometry is not coming. They're not giving me attendance. Like these things. So that condition in which skin is generally it peels off in the palms and the soles. It peels off like peeling completely. So what happens when this is happening? That biometry will not be easy for them. So we
Accept.
call this condition as keratolysis exfoliativa, but it is not as scary as you imagine. It can be nicely treated almost 80% of the times with plain moisturizers, but with special ingredients. So you should look for urea and lactic acid, which I mentioned previously in humectants. So urea and lactic based moisturizers will help you particularly in this condition what you're mentioning. So use them frequently, daily 4 to 5 times, apply over the palms. See for a week, 10 days. If then also your problem is not cured, we have some special medications to give you. But this problem is something which can be solved.
Great. That's a great reiteration, positive. And I think, Ravi Naik ji, you should be consulting a dermatology, and Apollo 24/7 does have dermatologists who can be available even if you are in a remote place. Well, next question is about darkness and blackness around certain areas. Tarun Sunkara is asking how to reduce blackness on the neck, and also Jamal Mohammed ji, any cream for forehead darkness patches. Swati Gupta is also asking remedy for dark patches on forehead. So these are forehead and neck. These are certain areas which look dark for certain people. Is it pigmentation? Why does it occur?
See, neck pigmentation is something which is, multifactorial. It is mostly hormone dependent. We call it acanthosis nigricans, the very thick, velvety, dark neck. So, one thing which is very important in reducing neck darkness, and some people, they get this underarm darkness and forehead darkness also because of hormonal components. So, one thing is reduce weight, because more than 50 to 60% cases it comes in overweight persons only, the neck darkness especially. So apart from the creams what we suggest or anything, reduction in weight, keeping your hormones under control is something which is very much needed for the neck darkness to reduce. So
सो
as
ये
I told you,
कॉस्मेटिक अपीयरेंस नहीं है, ये अंदर से है, इसका जो
yes, it
ओरिजिन
is
है.
very much from inside.
Yeah, so insulin resistance and other factors that they need to check, PCOD and
Insulin resistance, and we call it metabolic syndrome. And again, overweight is another very important concept here. Weight reduction,
जी मैम.
along with the creams which contains, as I told you, some of the skin lightening things like glycolic acid. These type of things work for the neck darkness. But again, I'll tell you, 50-50% contribution. 50% is the ointments and 50% from your side. Reduce weight for neck darkness.
जी मैम. Yeah. So yes, so it has to be addressed multifold and many other ways also that you need to internally start looking at. There's no one solution, as you have rightly said. My next question is from Sandeep Agarwal 97. My daughter has eczema, and which cream should I use for her? Well, children and eczema, that's when it starts off. And I
Yes,
know
yes.
how I struggled with my knees in her growing years. Nothing used to work, and finally she's now settled as she is growing up. So what
Yes,
would you suggest?
I'll tell you. See, children eczema is most commonly atopic eczema, so it's very common in Western world. But now in India also, there are a lot of children with atopic dermatitis. It can
Atomic
start
dermatitis.
as early as infancy when the kid is in months itself. So see, it is not genetic or it is not hereditary per se, but there are many, many factors which lead to this atopic dermatitis. An asthma in mother can get the baby atopic dermatitis again because both are
Oh,
allergic. An asthmatic mother has a chance of atopic child more than a non-asthmatic mother. This is again something which is related. And second thing is that atopic eczema tends to become better with age. It's not the same because your kid is suffered so much in childhood. It is not that it will
right.
continue in the adulthood. Most of them settle down by the time they reach puberty. And only thing they may face this kind of hand eczemas or something more than general population in their adulthood. How to control them? See, I'll tell you. Basically, what happens in children is dry, rough, and scaly skin and atopic eczema. So, the moisturizers you choose should be combination of both humectants and emollients, as I told you, and avoid irritants. See, uh, irritants are aggravating factors in atopic dermatitis are something like dust, pets. So if your kid is atopic dermatitis, again, pets, there's dogs and cats can actually aggravate their problem because of the fur, and carpets can aggravate. So no carpets at home also, and even the the curtains and everything you need to wash very frequently so that they are not dust. And the the detergents what you're using should be very very hypoallergic, kid friendly
My
detergents.
niece was allergic to the dyes, the
Yes,
dyes on the colors.
100% cotton clothes is 100% cotton clothes is something which is essential for children with eczemas. No mixture of clothing, 80% of cotton, 20% of something. No, it should be always 100% cotton. These are some of the precautions you take, give, and again, as I told you, shorter baths. Only use lukewarm water, no very hot waters, and reapply moisture very frequently.
Great, ma'am. So yes, while we're talking about eczema, Jamal Mohammed ji, who was asking about forehead patch, he tried some cream glycosix for 3 months. It did not work. जमाल जी, आपने सुना होगा कि आपको अदर एरियाज पे भी ध्यान देना चाहिए. इंटरनली कुछ और रीजन हो सकता है. डॉक्टर माधुरी, वुड यू वांट टू एड्रेस दिस अगेन?
Yes, see, and coming to skin lightening agents, it's never a single agent which is going to work. There are combinations of skin lightening agents which are required because monotherapy is not so successful. So one thing is sunscreen. What common mistake people do is they avoid sunscreen, go on applying these skin lightening agents. They're not going to work. See, normal skin also, sun causes damage and tanning. Imagine a person with already tanned skin and damaged and
जी.
pigmented skin. It obviously damages more. So sunscreen, you use sunscreen with SPF 50, reapply every 3-4 hours, and then night ones, don't use this monotherapy ones. There are some combinations which we give which contain many of the products. Those you can combine and apply and reduce weight if you're overweight. That is one thing.
ग्रेट जी। शिखा जैन जी, आपने फिर से पूछा है कि एक्सेसिव ड्राई स्किन इन विंटर्स के बारे में। वी विल कम बैक, वी मैम वाज ऑलरेडी आंसर्ड इट इन द बिगिनिंग, बट वी विल कम बैक टुवर्ड्स दैट इन द एंड ऑफ द शो। ऑल राइट, सो नेक्स्ट क्वेश्चन इज just a quick, eczema is done. Where did I miss? Yes, the question is here, registered users question. What to do about acne in winter?
So I'll tell you, see, acne is again multifactorial. It can be hormonal, it can be because of skin changes. Excessive oily skin leads to more acne, and again it can be what we apply can again lead to this irritation, and it can come out as pimples. So in winters, the moisturizers you choose should be for acne prone skin. Normal moisturizers you cannot apply because again they may lead to these pimples for you. So second thing, all the pimple creams which I give you are, the clindamycin cream or something which works for the retinoid, or clindamycin creams which we give for acne. What you should do is, the all the acne preparations dry out your skin because they take out all the inflammation sebum to in order to reduce the acne. So apply a moisturizer whole on the whole face, and on the top of it do only spot application of these creams like this, just tap it. That is something which will help you reduce dryness related to these acne preparations.
Yeah, yeah. Ma'am, quick question from Mr. Atif Hassan, 25-year-old male. There are red rashes on my face. If I'm applying turmeric powder, rashes are decreasing. Should I continue, or are there any other remedies for the same? Also, I just met an actor, co-actor on my set, who has sensitivity to cold, and she becomes red. It becomes irritating, flaky for her. It's literally like allergy. So well, she becomes all rashes all over her body. What is this condition?
Yes, there are something called cold urticaria, means extra sensitivity to cold. You get these hives and all when you're exposed to cold and harsh weather. So when you have such condition, it's not it's not always treated with plain moisturizers. We need some tablets for you, like some of the anti-allergics. Take them for a month like that. That will suppress that kind of allergic nature, so you react less, and can be maintained with moisturizers and emollients. And again, getting red rashes on the face when you are exposed to cold or sun in cold actually, uh, that is again a type of cold urticaria, or solar urticaria. You become red when you are exposed to sun. This again needs to be taken care with tablets, antihistamine tablets we call them. They're
No
anti-allergic.
amount of sunscreen helps her. The more she comes out into sun, she applies sunscreen, but it doesn't help her.
Tablets are required in such cases. Plain sunscreens
Yeah.
wouldn't help. They play only side role. Major role is done by the tablets, so tablets are needed.
Now, now this Atif ji's question, he's using turmeric on these rashes. So what would you suggest?
Turmeric itself sometimes can be very, irritating.
Harsh.
Um,
Uh,
yeah, because many people do this. They apply turmeric, but not all. Remember one thing: not all natural things are free from side effects. Natural things can irritate you. Sandalwood dries you out. Sandalwood dries you out. This you should know.
I totally
This is
agree,
one
ma'am. I
thing.
totally agree. Yeah.
So turmeric,
So
no, don't apply turmeric over that. Just switch to good moisturizer, sunscreen. Try with these two. If it's not working, you need help of tablets.
okay, that's it. And KD Sani ji पूछ रहे हैं 65-year-old है. Please give us tips on diabetic skincare.
Mm. Diabetic skincare, as I already told you, like don't keep on scratching your leg. Most people do that. Don't keep on scratching. Take the help of medication initially if you want, and application of ointment based emollients. Do it that also repeat 1 or 2 times a day, and take shorter baths. Avoid very hot water.
Yeah, great. So now that extreme winters, harsh winters, especially towards northern India and northeastern India, when they have these harsh climates, it's very different from South India, I understand. If I am facing
Yes.
on a scale of 1 to 10, if I'm facing 5, they're facing 9 and 10. Are there any specific region and geography specific things that we need to do?
Yes, yes, because the climate and the temperatures are also different in high altitudes. The sun is very harsh. Most of them will have this pigmentation on the cheeks that is more in high altitude places. Why? Because what they tell is we don't have sun at all. You don't have sun
Correct.
means, see, the amount of sun itself which is there is damaging more than the complete sun. So sunscreen is a must for them, and SPF 50 is needed for them. 30 is not sufficient. SPF 50 is needed, and cream based. Don't go for lotions. At least use cream based moisturizers.
Yeah. The other question that I wanted to ask you is, Swati Gupta, please, what Swati? So after sunscreen, can I use CC cream or face powder?
Face powder is okay. Makeups is also okay. Use sunscreen with a moisturizer as a base. See, there are a lot of additives these days. Plain sunscreen with matte effect can again dry you out in winters. So, use a sunscreen which has certain emollients in them. They can give you a moisturizing and sunscreen effect at the same time. Apply it as a base after cleansing your face. Apply that as a base, and on the top of it you can apply your makeup on the top of sunscreen with moisturizer. In
Yeah.
winters you can apply powder or makeup anything.
Okay. Tanya Tanu, 19-year-old, what helps best on acne prone skin? We did talk about it just a little while ago, Tanya. You can just go back after the show also and then check what Dr. Madhuri has answered. Well, let me ask you about foods that one can consume. Can winter में थोड़े गर्मी के लिए हम लोग जो खाते हैं, especially north में sesame oil, mustard, everything increases. So, are there any foods which are warming in nature that you eat and it damages skin, or are there foods which help skin?
See, only thing is the hydration. Keep good hydration, and food you can have everything. No issue at all. No need to avoid some things. No, no need to avoid. Just take whatever you want to take, but drink lots of water so it is hydrated. In winter, you tend
Okay.
to avoid drinking water. That is a common mistake people do.
I need to switch here to Telugu for a lot of people who understand this. వేడి చేసింది, వేడి చేయడం వల్ల పెదాలు పగిలాయి, వేడి చేయడం వల్ల స్కిన్ పగిలింది, నాకు పాదాలు పగులుతున్నాయి వేడి చేయడం వల్ల. दैट गर्मी जब होता है, क्रैक्ड लिप्स होते हैं, क्रैक्ड स्किन होता है, क्रैक्ड हील्स होता है. ये माना जाता है. What would you advise and what is remedy? Cracked heels के बारे में somebody Mani was also asking about cracked heels.
Yeah, cracked heels again. You need to use something like salicylic acid based creams, and that is use that salicylic acid based cream at and in the night or something like that, and in the morning use good moisturizer with the urea such kind of things so that these cracks will settle down, and regularly use for at least 2 months so that these respond. They take time. Cracks take time to respond. And second thing, wear slippers even when you are at home, because the friction between the toe and the ground again increases chance of these cracks.
Yeah, yeah. And then my question of warming foods and then skin becoming dry and brittle.
Yeah, foods again, skin becomes dry because of lack of oil and water. So that is purely related to the skin. So food you can take everything and anything. No need to
So,
stop
ఈ
anything
వేడి
because
చేయడం
it
అనే
is
కాన్సెప్ట్.
warm sensation.
Yeah,
As far as skin is concerned, it is just dehydration and hydration. That's
that's it.
ante. Hmm.
Okay. Chavi Sharma's question next comes up. It's Chavi's question. She is 25-year-old female. I work with powdered gloves on for more than 24 hours a day. It has made my hand skin very rough and dry. My nails are very brittle. What can I do? This are certain, especially medical professions, you need to be there with gloves.
Yes, yes, yes. Not only medical professionals, this problem occurs with housewives who do a lot of household work. They're exposed to these detergents, the cleaning soaps and all,
Gosh,
and water for a
yes.
lot of time. So that again leads to excessive dryness and eczemas. That hand eczema is most commonly seen in housewives who just keep on, washing their hands and using detergents. So what I tell is, use these kitchen gloves when you're doing this kitchen work and all, so that you not contact with the water and
Direct
detergents
contact.
directly. Direct
Yeah.
contact, no. Use gloves or anything, and then on the top of it, you use this moisturizers frequently. And medical profession is concerned that rubber, the powdered gloves are allergic to many people. There is only one option for that: switch to non-powdered gloves, because whatever treatment I give, unless you switch to that, you're not going to respond, because the basic factor why you're getting is the allergic to that powder. So when that factors go on continuously going, so even my treatment wouldn't work. So switch to
Okay.
non-powdered gloves, and then try emollients moisturizers first. If still it is not relieving, then you need to go for proper medication.
ओके छवि जी, आई थिंक जो वर्क आप करते हो जो डिमांड करता है उसके लिए थोड़ा कन्वीनियंस भी आपको डिमांड करना पड़ेगा. आई थिंक यू शुड स्विच टू वेयरिंग नॉर्मल ग्लव्स
We
एंड
should do
देन
certain lifestyle modifications according to our skin.
exactly, ma'am. Yeah, one last question, ma'am. Sayantika, 32-year-old female, please suggest skincare products for keratosis pilaris. What term is this,
Oh,
ma'am?
keratosis pilaris is nothing but a chicken skin. See, you see this very, bumps, kind of things, especially on the
Right,
arms.
right, right.
That you call it keratosis pilaris. It is something which is very chronic. So, how to maintain it? As I told you, moisturizers with urea and lactic acid, they work better for keratosis pilaris. Use them nicely daily, two to three times. And there are certain retinoid based creams. One time in the night, just apply that, and two times apply this moisturizer and try. So keratosis pilaris is again a vast disease with lot of spectrum. Some people will have very mild disease, so with moisturizers itself it subsides. Some people we need to give medication also, oral medication also.
Okay. So is it the same with back acne? That's back acne. Muskan 20 is asking the same question.
Yes, back acne or truncal acne, it is more resistant than the facial acne actually. And the thing is very difficult to apply the ointment also. On the face, I'll tell you to apply just two spot application, they can do like this. But what about back? Back they cannot apply also. That is one thing. So nowadays, what I am generally giving is this kind of washes or foams which you can easily apply just all over the back. Take somebody's help like that. Those kind of washes, or you can even try this salicylic acid first. Just try that salicylic acid, take somebody's help, apply apply all over the back, leave for 15-20 minutes, and then go to bath. Try this first. If this is not going to help you, truncal acne also needs a bit of medications because it is very resistant.
Yeah,
Back
yeah.
acne.
Yes. So that's it for today. Aravi, you just joined the show. We did talk about moisturizers for damaged skin. We did talk about it.
Yeah, a
Bleaching
lot
has damaged.
actually.
Yeah, yeah. Bleaching has damaged my skin, is what Aravi says. But yeah, let's wrap this up. I would want you to give me like how Shikha and Amuta, all of them are asking winter care, especially for dry skin and also damaged skin. Top tips, please.
Okay. Top tips, yes. So I want to tell you certain things. So daytime, use creams or lotions which are less greasy and easy to apply. And hairy areas, use these lotions, one thing. And for very, very dry skin, go for ointment based ones. And second thing is reapplication whenever you become wet, or whenever you wet your hands, wash your hands, reapply again. And coming to soaps and all, choose scented bars which have slightly acidic pH close to the skin, and use only lukewarm water for bathing, and take shorter baths. And lotions do contain preservatives, so whenever you're shifting to a new lotion, just try it in a small patch of skin. And if you are comfortable with that, then only use it to a whole of the body. So, and sunscreen is a must thing in winter. Don't neglect sunscreen in winter. If you have if you have a general skin, then SPF 30 is something which is enough. If you have pigmentation and anything like that, go for SPF 50 like that. Yeah.
Great, ma'am. Thank you so much. It has been a very,
Yeah.
very informative session. I'm now feeling very recharged. I'll take care of my skin very well this winter. But thank you so much for your patience and your time on the Sunday morning.
Thank you very much,
Thank
Jansi Garu, for a good, good questionnaire and, good program,
you.
smooth program.
Audience are always thirsty for answers. They really
Yeah.
participate well. Thank you, ma'am. Thank you so much once again. I
Uh,
Well, that is Dr. Madhuri who gave us wonderful information. And here are gift coupons that you can use on Apollo 24/7. Download Apollo 24/7 first and then use these vouchers. The first code that we are giving away is first VC, FIRST Use KJ and then you get up to 199 off on 150 rupees off on doctor consultation. And then next code is first 3 direct from Apollo, get flat 25% off on online medicine orders. This is applicable on the first 3 orders when you make these place these orders on Apollo 24/7. And to the exclusive viewers of Health Hour, we give you this coupon which is called HH247. The next coupon, please. Use the code HH247 to get up to 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders. So these are the coupons that we are giving away for you, viewers. And next week, it's a very interesting topic. Anybody who wants to quit smoking, please come and join us. We're going to talk about the tips on quitting smoking. How is it difficult, and how do you reach to an area, to a place where you have declared that you have quit smoking? If you want to do that change, join us. Come, take a firm stand, and we will give you. It's not easy. I know it's not easy because I've seen people in our own family who struggled quitting and who have very easily quitting. You require professional help on this, and we are bringing you a professional expert to help you quitting smoking. So join us 4th December, Sunday 11 a.m. And if in case you don't want to miss this session, do something that you can easily be reminded of. Subscribe the channel and also activate your notification buttons as well. Thank you so much for joining us this Sunday. See you next week.